We're now so honored to introduce Kevin Counihan, CEO of the Marketplace and the Deputy Administrator at the Centers for Medicare and Medicaid Services, who joins us to share where we are today ahead of Open Enrollment 4 and what lies ahead in terms of CMS efforts to ensure a more stable and strong future for the marketplaces.
Hi, Catherine. It's Kevin. And first, thanks so much for the invitation to present today and talk to the audience. It's also a real pleasure to be reacquainted with some of the panelists. So Erica is a longtime person I've known for quite a while and value that. And Calvin I've known for a bit. Ed and Michael appeared at our June Innovation Forum. We had another one just in October. Dr. Patel and John couldn't have presented, I think, some of the strategies for success any better in their innovations, certainly as did Ed and Michael. So it's a pleasure being here. I'm going to take a little liberty, if you don't mind, Catherine, to be a little bit more concise with our slides. I'm going to begin actually with slide 5 to talk a little bit about where we are with respect to some results to date, and then talk a little bit about where we're going. And I also would like to spend a little time just talking to some of the good thoughts that came out of both Florida Blue and Horizon Blue Cross with respect to some suggestions and some of our initial thinking on that. First is, I think we all know that the ACA now is going into its 4th open enrollment period. We've been in operations actually for 3 years, because that's the operating time that we've had. We've had pretty good success, I think, to date. When you combine the exchange enrollment plus Medicaid expansion, as you know, we're about 20 million that now have access, and the uninsured rate has dropped from about 14.4% in 2013 down to 8.6%, which is the first time it's been below double digits. So again, don't feel that we've solved every problem, obviously, but feel like we're making progress in our position to continue to do so. In addition, millions of Americans have now benefited from no longer being subject to pre-existing conditions, having the benefit of no longer having lifetime or annual limits, eligibility for preventive care services. Millions and millions of Americans have benefited from law, even outside those that have enrolled in the exchange. So again, good progress being made, obviously more to do. Moving to slide 7. The satisfaction with the marketplace is also in good shape. Again, opportunity, of course, always to do better. But various studies, whether it's J.D. Power, Urban Institute, others have shown that consumers in the marketplace are as satisfied, and in some instances more satisfied, with their enrollment experience and marketplace coverage than actually those with employer-sponsored insurance. So again, more to do, but again, I think we continue to make progress. Moving on to slide 9. Obviously, affordability is a core part of what we continue to do and will continue to focus in on as we have. Roughly 70% of our consumers are able to find plans for less than $100 a month with tax credits. Roughly 83 to 85% of our enrollees overall receive subsidies of some sort, whether that's through advanced premium tax credits or through the cost-sharing reductions. But I think it's important for your audience to know, Catherine, that we care about and are focused in on everybody. So not just subsidized enrollees, but all enrollees and those that are off the exchange too, because this is all about trying to manage care effectively. Premiums, of course, are a manifestation of costs, and certainly we know that the controlled healthcare cost is the 800-pound gorilla, and it's something that, again, I think when you look at MACRA and other things that have come out of CMS recently, I think we're making progress. Obviously, more to do. We're very pleased to be working with the healthcare carrier partners that you have on the program today, who represent some of the best practices with respect to helping to provide more continued affordability. If we move on to slide 10, and we talk a bit about some of the areas that have made such a difference Clearly, the financial assistance has been so critical. As mentioned earlier, roughly 83% of our enrollees receive tax subsidies, so it makes a huge difference with respect to affordability. Again, increasing minimum coverage so that the coverage is more comprehensive has also made a huge difference and has reduced a lot of some prior issues with respect to bankruptcies due to medical costs or other types of things. Guaranteed issue, the ability now that women, and in my former state, before I took this job in New England, women in fact were charged roughly double what men were for the same coverage. That has now all gone away. Obviously, as we all know, kids can stay on their parents' plans to 26. And what we are trying to do, and again, have more to do, but clearly are trying to do, is to not only make the enrollment process easier and simpler, but also to make information more transparent. We have introduced a series of new decision support tools last year with respect to pharmacy lookup, facility lookup, the same for prescription drugs. And that is continuing again into this year, where we have a new plan comparison feature that makes shopping and comparison of plans even easier. Again, that will never stop. We will always be working in a way to try to make this experience easier, not only for the consumers, but also for our carrier partners. One of the things that is important for this audience, I think, to understand is going into next Tuesday's launch of open enrollment, that our system, whether it's the enrollment system, our operations, our IT platform and such, continues to be more stable and more efficient. Last year, for example, in Open Enrollment 3, at the peak of enrollment, we were processing roughly 9 enrollments per second. And our ability to do that is even expanded this year. So feeling more confident than ever about the service capabilities of our enrollment system and also the consumer experience going to Open Enrollment 4. Going into slide 11, talking about some of the early lessons learned, I think that Dr. Patel, John, Ed, and Michael did a very fine job of talking about a couple of things that we've learned. One obvious thing is that the one-size-fits-all approach with respect to either understanding the market or medical management, care coordination, provider contracting, does not seem to work as effectively for marketplace enrollees. One of the things, as I mentioned, is we've had forums on issuer innovation twice this year, once in June and again in October at the request of carriers. And one of the interesting things for us, at least, is we have begun to understand the commonalities of successful issuers in the marketplace. These are issuers that are both growing and are profitable. And they are sharing almost the exact same things. Tactically, they can be different based on the region of the country, based on the provider community, but with respect to the overall category of what they do, they're almost all the same. And so another feature that we've done is we're actually meeting with issuers throughout the country that have expressed interest in understanding that better, and meeting with them to walk through some of those. And we're getting a lot of interest in that regard. So that's been a huge lesson for us. We're also, conversely, beginning to understand the commonalities of those issuers that have been less successful. And interestingly enough, they also fall into common categories. They're clearly different categories from the ones that have been successful, but they fall into the same buckets of commonality. So that's equally instructive, and things that we're also sharing nationally with issuers. More to come on that. I believe it was that it was Ed who talked about retention and the need for constant deliverables of value, and how he spoke to both this being a weekly and monthly effort. That is a best practice, and Horizon, by the way, has several best practices. But that point about how to constantly touch the enrollee, constantly show that value is being provided, the type of redesign of their welcome kit, for example, they've done some very clever things, have things that we've talked about and again displayed in June. I think what John and Dr. Patel spoke about with respect to the pods and other things that Florida Blue has done. It has been extremely, extremely instructive. Again, represents best practices that are now being imitated by other companies throughout the country. He also mentioned, as I recall, the importance of not having a one-size-fits-all approach, the analysis that they've done in the marketplace, the type of joint ventures or other alignments that they've had with other stakeholders in the state of Florida. Again, very, very thoughtful approach. Finally, I believe that Dr. Patel was mentioning the importance of working with leading indicators, looking at monitoring such things as ER visits, pharmacy usage, and the importance of claim coding. Couldn't agree with that more. Again, a best practice, clearly finding that type of attention and detail helps make issuers very successful in the marketplace. So very pleased to be able to share some time with both those. A couple of things that came up, and I think that John had mentioned that I just wanted to provide some reaction to, because I think that these are clearly good issues. One was the issue about the special enrollment periods and the impact that can have. One of the areas that John, that you may know, and then again you may not, is that beginning next year we are going to be piloting a pre-enrollment, mandatory pre-enrollment verification process for all SEPs. This is something we've had discussion about with issuers for some period of time now. Feel it's the right thing to do, want to test it at the request of issuers and the trade associations. And so pleased to be able to announce that because we clearly want to be responsive to that concern. The second was around the issue of third-party payments. Couldn't agree with that concern more. A month ago we published an RFI on that with respect to soliciting comments on proposed ways that we can do that. We've had some good reaction to that. We're moving ahead with that very aggressively, and over the next month or so you're going to see some response to that. The grace period issue, the 90-day grace period, that I think, as so many folks may know, is a statutory requirement. Will require a change to the statute to address that. Again, think there's a lot of opportunity for good discussion about that, but that is a statutory issue, and we certainly hope we're going to get the cooperation of Congress to look at that and other things that need to be tweaked. The President, a couple of months ago, in a JAMA article, outlined other ideas that he had with respect to ways to make the exchange in the marketplace improved. And so clearly good opportunity for rich discussion there. So in conclusion, just a couple things to say. One is that moving into open enrollment 4, I'm actually more optimistic about the marketplace than I've ever been. And the reason why is because, A, we see a good pattern of success by issuers, and I think we've seen a couple of great examples this afternoon. The second is, and perhaps this is most important from our perspective, is the level of engagement by issuers nationally that are saying, hey, help me be like those guys. What can I do to understand what they've done? Can you help me understand these best practices and how I could incorporate them? I may need to tweak them. I need to change them. I may need to modify. You know, being in the Midwest is going to be different than in the South or in the Northeast, but I understand that people are people and that this is important to do, and I want to make it work. That type of engagement and commitment is so critical to the success, because we know that leadership is critical here. The most successful issuers in the marketplace have a core commonality from the beginning, which is commitment from leadership. So that's one of the reasons I think that we're most optimistic about how things are working. With respect to, again, stability of the system, best shape we've ever been in. Outreach, we are more sophisticated and refined with our messaging. We understand the things that work. We understand the messages that don't work. We understand the messages that can get to populations that are critical to grow, such as the 18 to 34 segment. Extensive research there, and we've doubled our budget to help reach those folks and to enroll them. So again, excited about open enrollment 4, recognizing too that this is never going to be finished in 3 or 4 years. This has always been a multi-year project, but very excited about next Tuesday. And again, appreciate the opportunity to be on this with these distinguished folks.